Hi Melanie, I'm Paige. I'll be your nurse for the day. We're just going to go over a physical assessment. We're just going to start out with some vitals here. And when she walked in the room, I noticed her posture was straight, her gait was steady, no swaying or anything like that. Straight out. (122/80). And then I'm just gonna listen and feel your pulse, and while looking at respirations as well. Pulse was 72 and respirations were 16. I do not have a thermometer, so we will be not doing the temperature. I'm looking at her face and her head. Looks symmetrical. Everything looks even. Skin color is even throughout. I'm just going to touch your scalp. Tell me if there's any tenderness. Hair feels soft. Just checking for lumps or bumps. Any tenderness anywhere?
No.
Okay. Then I'm going to move on to your eyes here. We're going to read the 20/20 line, and we're going to hold it about 2 feet from you. Can you read this last line for me?
DEFPOTEC.
Perfect. Then I'm going to have you cover one eye. Read that same line again.
DEFPOTC.
And then other eye.
DEFPOTEC.
And do you wear contacts, Melanie?
No, I do not.
Okay. Perfect. And then I'm going to examine her eyebrows. They look even, symmetrical. Eyes are symmetrical throughout. I'm going to feel the lacrimal ducts. If there's any tenderness or swelling, I'm going to have you close your eyes. I'm feeling the ducts right above, right on the eyelids. No swelling or tenderness there. Melanie, I'm going to have you look at the corner and then look at my finger. Eyes accommodate. I'm going to have you focus on my finger. Good. Eyes converse. I'm going to have you look straight ahead at me. I'm going to check your pupils. Pupils are reactive to light at 2 millimeters. And this is testing cranial nerves 3, 4, and 6. I'm going to have you follow my pen light with just your eyes. Cranial nerves 3, 4, and 6 are intact. I'm also going to check your peripheral vision. So I'm going to have you cover this eye while I cover my other eye. And you tell me when you can see my fingers.
No.
Look straight ahead at me.
No.
Good. And switch other eyes.
No.
Good. And this is testing cranial nerve 2. And that is intact as well. Now I'm going to get really close to you. I'm going to test the red reflex and take a look at the optic nerve. Good. I can see some vessels and it's looking orange to red colored. I'm also going to take a look at the cornea. I'm going to have you look just straight ahead for me. Cornea is clear and smooth. The sclera is white with some vessels. The cornea and the iris are green, intact, equal, symmetrical in size. And then we are going to move on to the nose. The nose is midline in the face. The skin is even throughout. No lesions, any lesions or skin impairments there. I'm going to take a look right up your nose if you want to just bend your head back for me. I see 3 of the turbulates, and there's just a little bit of drainage, and mucosa is pink. I'm going to just test your patency of your nostrils. If you want to plug one and breathe in. Good. And then just through the other. Good. Seems that the right one is a little bit more open than the left. And then we're going to test their cranial nerve 1. So I'm going to have you close your eyes and plug one nostril for me. And I want you to tell me what scent this is.
Alcohol.
Yes. And I'm going to have you close your eyes, and now I'm going to have you plug your other nostril. I'm going to have you smell this. Still not smelling it?
Coffee.
Okay, good. Olfactory nerve is intact. Then we're going to take a look at the ears. I want to see that the ears are symmetrical and aligned. They are. Any tenderness at all?
No.
I'm feeling the tragus, the pinna, palpating to see if there's any tenderness, no redness, or any skin impairments. I'm just going to take a look at the tympanic membrane here. It is white, and the location is 5 o'clock on the right and 7 o'clock on the left. Now we're going to test cranial nerve number 8, auditory. So Melanie, I'm going to have you cover one ear, and then I'm going to whisper 3 words, and I'm just going to have you repeat them if you hear them.
Apple, mouse, key.
Then I'm going to have you cover the other ear.
Dog, cat, mouse.
Auditory nerve number 8 is intact as well. And then I'm also going to feel your sinuses. Tell me if there's any pressure or pain in any of these areas. Any tenderness at all?
No.
Good. No swelling, or anything around the sinuses. And I'm just going to pause this to start a new video.